Hello viewers, I'm Afzal from Observatory and here with the weekly updates. The COVID-19 cases in India has become alarming with total 12,87,945 confirmed cases as per the data of Ministry of Health and Family Welfare. The confirmed COVID-19 cases in Bihar has reached 31,980 till date. The central team, which visited Bihar earlier this week to assess the COVID-19 situation in the state, has said the very low testing ratio in the state as compared to the national average may impact its case fatality rate due to the pandemic. At 3,423 per million, Bihar has the lowest testing and mortality rate in India. While expressing concern over the increase in the case positivity, the three-member central team, in a letter to Bihar's health department on Wednesday, said the low testing might result to the spread of infection, late identification and late arrival of cases in the hospitals that could impact the case fatality rate. The team headed by Shri Love Agarwal, Joint Secretary in the Ministry of Health and Family Welfare, and comprising Dr. S.K. Singh, Director of the National Center for Disease Control, and Dr. Neeraj Nischal, Associate Professor in the Department of AIMS Delhi, was in Bihar between July 19th and 20th after an alarming spike in the cases of coronavirus in the state. Bihar has been reporting over 1,000 cases since July 12th, and 90% of its total active cases have been reported in the last 7 days. In the last 1 week, that is July 16 to 23rd, the number of new infection has grown by an average of 6% every day. Mr. Agarwal also asked the state to ensure capacity utilization of existing RT-PCR test laboratories, beside taking action to increase the RT-PCR testing also. The ICMR has approved 9 laboratories, 6 in the government sector and 3 in private to conduct RT-PCR tests in Bihar. The central team called for leveraging antigen tests for undertaking samples in the containment zones and hospitals, beside monitoring all symptomatic negative results of antigen tests through RT-PCR. The team said East Champaran, Gaya, Rohtas and Muzaffarpur were emerging hotspots in the state. It also called for special attention in Patna, Nalanda, Nawada, Siwan, West Champaran, Jamui, Bhagalpur, Begusarai and Munger in view of large number of cases. The center cautioned on hospital infrastructures and suggested setting up of temporary field hospitals, taking into consideration the case growth trajectory for at least the next 2 months. With a case doubling rate of 11 days, Bihar, which had 30,066 total cases on Wednesday, could be staring at close to a million cases in a month if the doubling rate remained the same. 2 doctors infected by COVID-19, including a civil surgeon, died at the AIMS Patna on Wednesday. Even as the Bihar Health Service Association threatened to boycott the work if its demand on improving health infrastructure and investing on human resources was not met. This was the first death of a civil surgeon and 5th reported death of a doctor infected by COVID-19 in Bihar. The state BJP headquarters has been shut on 14th July, Tuesday, after nearly 20 party activists, including half a dozen office bearers, tested positive for COVID-19 during the initial rapid antigen testing carried out at the party office previous day. Among those who tested positive include organizational secretary, a general secretary, one of the party's spokesperson and a president of Delhi. Unconfirmed report put to the total number of party members infected at 75. Even as the COVID-19 positive cases continue to rise in Patna and Bihar, the Patna District Administration on Saturday launched first of its kind free of cost rapid antigen testing at 25 healthcare centers in the state capital. The DM in a release said the test would also be performed by 5 mobile teams. Besides the test at the healthcare centers, the mobile teams are to work in urban areas and conduct tests of old and physically challenged people in containment zones, he said. With this, we come to an end of this week's update. Please subscribe to our channel. You may also send your feedback on our website. Thank you for being with us.